All right. So, thank you everyone for joining today's webinar, and thank you, Poorna ma'am, for joining us. So, today we going to discuss about like how OPT, like oral placement therapy, help in speech and feeding. So, most of the time, parents has questions around this, like, okay, uh, they're I mean giving speech therapy to their kids, but still it's not working. They are not able to speak certain words or to say certain sounds. They are not able to speak. So as well as in feeding, they face certain problems. So the scope of today's discussion would be around OPT, like how OPT help and what are the areas which where it help basically. So if you have any question related to uh, oral sensory issues or how you can work on your kid to improve their speech and feeding issues, so you can ask those questions in chat. And at the time of registration, we have received certain questions. So the flow would be like initially, Poonam, I'm going to walk us through like what is OPT and how it actually work, and then we will take those questions, and then we will take questions from the chat. So first 30 minutes, she will be going to walk us through this, and then we will start question and answer. So meanwhile, if you have any question, you can put it in chat, and then from there we will take it up. All right, ma'am. So over to you.
Thank you. Good afternoon, everyone. First of all, I would like to thank Autism Parents Forum for giving me opportunity to share my learnings and experience with you. I would be talking about oral placement therapy, how it helps you our kids in feeding properly and getting the speech clarity. So today's agenda will be first I will let you know I am, what is oral placement therapy, who benefits from OPT, what areas oral placement therapy can help you, importance of oral structures for speech and feeding, how does our oral placement therapy help with feeding and speech, and how can I do it with my child at home. At the last, we will conduct question and answers. So about me, I'm a parent of superhero Dev who has cerebral palsy. He's 16 years old. We run a foundation, Dev Child Development Foundation, where we support kids for their education. Professionally, I'm a level 3 oral placement international therapy. I am listed on TalkTool website. Apart from that, I'm also certified in reflex integration, handwriting without tears, brain gym, and jollyphonics. Believe you can, and you are halfway there. If we believe in something, that means that we are ready to get it. And if we are trusting something, that means we are already achieved the half of the 50% of that thing, right? So what is oral placement therapy? Oral placement therapy is a speech and feeding therapy which utilizes a combination of auditory stimulation, visual stimulation, tactile stimulation. It accompanies traditional speech therapy with tactile and proprioceptive teaching technique. So what how it is different from traditional therapy? I'm not asking you to stop traditional speech therapy. It is going to accompany that traditional speech therapy, because when we are doing the speech traditional speech therapy, it's like, look at me, imitate and do it, okay? But here we are giving them a tactile and proprioceptive input when we are doing the oral placement therapy. So oral placement therapy was developed by Sarah using a muscle based approach wherein we work on the muscles of the mouth to get adequate feeding and speech clarity. Who can get benefits from the oral placement therapy? Oral placement therapy can be used with many ages, that is from infants to adults or geriatric population. Like I can give you an example. I attended a child who is only 6 months old, and we can get an idea from the structure that how he is going to get do the feeding later on, and how the sounds are going to come. And to the geriatric population, sometimes people get stroke or they get a paralysis attack at the any age like 40, 40 plus 70. So we can do this oral placement therapy with them also to get the muscle control back. It can be affected with a variety of populations and diagnoses included but not limited to autism, Down syndrome, cerebral palsy, apraxia, and TOD, that is teeth and oral tissues. Like we have, sometimes tongue tie or our frenulum is attached, so we can do it with that also. What areas oral placement therapy helps with? OPT helps to improve speech clarity and feeding skills, paying attention to oral structure placement in movement systems while simultaneously increasing utterance length for articulatory success. Sometimes child is not aware of his structure or how to do the perfect placement or use it, how to use the tongue, how to use the jaw. They have the strength or not in the jaw, their lips are strengthened or not, or their sensitivity is affected. Sometimes they are hypoactive, sometimes they are hyperactive, sometimes their sensation is like mixed. So to improve that, oral placement therapy helps. And we know the muscles, whatever muscles we are using for feeding, they are going to give support to the muscles we are using for the speech. So like I earlier told you, the traditional methods are around primarily are using primarily auditory and visual, like, you know listen to me, look at me, and do it. But OPT is used to improve articulator awareness, placement, stability, and muscle memory. And that is the necessary for the development of speech clarity. Like we are giving an input to the child, like we are giving the tools for the to the child to do the muscle memories. Like we are giving the input. Okay, I'm giving in a straw to make the oval of the mouth, like rounding the lips. Okay, and but if I'm asking the child that make a O, maybe he is not ready to process that information. So we are giving the tools. We have different tools. Like if I'm giving the tool for the straw for the lip rounding, that brings the lip rounding, and I'm giving an input. It's creating the sensory input also, and it's giving the structure also. So how our jaw, lips, and tongue, what is their importance? How important each tongue, lips, and jaw are, and how to strengthen them. Okay, so first let's think that this is an acrobat. Jaw, we have lot of teeth. So jaw is like the lower one. Jaw is the first uh, important structure in our mouth. Then there comes the lips. We have two lips and one tongue. So it's like if our jaw is weak and our lips are like closed and they are strengthened, or our tongue is very nicely moving, lateralizing, or we are moving it vertically, also elevated, but our jaw is not strengthened, then obviously tongue and lips are not going to work properly. So everything is in the, it's in the combination we are working. And we are going to do the dissociation also, because sometimes what happens is child is, sometimes people come to me and they ask that my child is eating everything properly but his speech is not clear. So I have to check how the mouth is actually working. Is the jaw, lips, and tongue are working together, or there's a dissociated movements there, right? When we are working, when my jaw is not strengthened, okay, so child is taking the food on the tongue and he is mixing it with the saliva and taking it, swallowing it, or maybe the tongue is pushing the food back, there's a lot of tongue thrust. So I'm putting the food in my child's mouth and child is just swallowing it or giving it back to me, right? So these all are working together for feeding and speech, but they all have dissociated movements. They all have their own function. Jaw is like for chewing, lips are for taking the food in and producing the sound, and our tongue is basically moving the food laterally and making the sound when we are moving it. We are doing the elevation. What areas oral placement therapy helps with? So, oral placement therapy helps to improve speech clarity and feeding skills. paying attention to oral structure placement and movement systems, while simultaneously increasing utterance length for articulatory success. The traditional methods are around primarily auditory and visual. OPT is used to improve articulatory in awareness, placement, stability, and muscle memory, which are very necessary for the development of speech clarity. Now let's see how is it going to help with the feeding in speech. So first of all, our sensory system comes into the picture. Our sensory and motor system are connected. What you feel from the environment, any sensory feedback you're getting from the environment helps you to move your system, right? Like if the child is feeling something, there's something, it's a hot plate and child is going to touch it, so his sensory system will tell you just take your hands off from it, right? So my sensory system is giving me an instruction, my brain is working on it, and my child is taking it off. But if he cannot feel it, he is not aware about it, so he will keep touching it. Sometimes it happens the child is not able to feel the pain when they are getting any wound or something, right? Then it comes to the feeding skills. So sensory and feeding skills are interconnected. If my child has no awareness about whatever I'm putting in, okay, so when my child has a hyposensitive system or hypersensitive system, like I'm giving him something, okay, and he is feeling 200% of it, like I'm feeling 100%, he is feeling 200% of it, that means his mouth is having the hypersensitive system. So if I'm giving him something with a good taste, he is going to feel 200% of it and he will not allow you to give it to him, right? And if my child has a hyposensitive system and I am giving him something, so the thing I am feeling 100% of it, but he may be getting the 20% or 30% of it, so he will need more crunchy food, more tasty food. Like you need 1 spoon of salt, so he will be needing 1.5 spoon of salt. So that's how our feeding and sensory system is interconnected. Feeding skills are very important because we have to see that when we are giving him something, the child is not choking or gagging. He should get the proper nutrition. When he will get the proper nutrition, when he is chewing it, our juices are getting, it's he is making the food, he's chewing the food properly. Our juices are getting in, and motor skills are developing, because when we are chewing we are using our muscles, and the motor skills that are we are getting with the feeding, those are prerequisite for the speech movements, because whatever muscles we are using for the feeding, we are using it for the speech also. Okay, then it comes to the oral motor skills. Some clients do not develop the motor skills when they are practicing only speech or feeding. So we have to give them both. We have to develop the feeding skills also and the motor skills also. So when I am taking food from the spoon, I have to check the way I am giving the food from the spoon. It's like when I do this, my lips are closing. So I am teaching the child how to close lips on the spoon, and I am also uh, preparing for the sounds of bilabial. Okay, that like ma pa ba. We need to close our lips to produce those sounds. So when I am feeding with the spoon and he is clearing the spoon with his lips, I am actually strengthening my lips, right? Then I come to the speech clarity. So, like I told you earlier, my jaw, my lip, and my tongue are working together, but they have their own functions. So, jaw, lip, tongue dissociation is necessary for standard production for all sounds and corrected speech. If I'm taking my food from the teeth, okay, so I am not actually strengthening my lips, and my lips need to be strengthened to produce the bilabial sounds, and my jaw is not responsible for making sounds. I know my jaw height is responsible for making the sound, but when I'm clearing my spoon with the teeth, it's not going to help me in the production of any sound. Okay, so can I do it at home with my child? Yes. under the guidance of a therapist. You can obviously do it at home. It is a home based program and can be done by parents. And because I believe that parents are the best guide, best therapist for their child, you can learn how to do it. You can take a home program and do it yourself by by contacting by in the guidance of the therapist. You can send them videos. You can ask them for their advice. They can guide you, and you can follow the program to get the results. So hope is the most existing thing there is in the life. I think I've finished my presentation very fast. I can take your questions. I'm ready to take the questions.
Okay, ma'am. So, can we take those questions first, which we had discussed, like which I shared with you?
Yes, yes. So please, you just take question one by one, and I will be answering.
All right, all right. And if anyone has any question, then they can put in the chat box.
Chat box,
From
yes.
there, we will take those. Uh, okay. All right. One question is like, my child avoids eating dal chawal.
Mm-hmm.
How to feed? And it's not only with dal chawal. I mean, we have noticed like there are kids who are picky eaters. So, is it related to OPT, or it's a separate issue?
So sometimes what happens is it's not only dal chawal. Picky eaters, picky eaters like they have only 20 to 30 things they can eat, right? Other things they are avoiding. Okay, so first of all, we have to look at the reason why he is not taking the food. Is it a sensory issue? We have to look, what is the tone of the body, because whatever is happening in the body, it's happening in the mouth also. So is he not feeling the texture what we are giving it, or he is not able to take the mixed texture? Like dal chawal is a mixed texture, right? So is he not able to take the mixed texture inside the mouth? That's why he is avoiding it. Is he not feeling the texture, or he is getting overwhelmed with the texture? So first of all, we have to find the reason behind it, why he is doing it. Then we have to work on it. And obviously, yes, we can work on this with the OPT, because when we are working with the OPT, when we are working with OPT, we are going to work on the textures and everything. We will be providing the sensory input in the mouth.
All right. All right. Kavita has raised her hand. Kavita?
Good afternoon.
Good afternoon.
Yeah, I was told by the OT teacher that my son has got a weak jaw,
Okay.
and otherwise she feels that he can move his tongue here and there, but
Mm-hmm.
his jaws are weak. He
Okay.
got his speech back. Matlab, he is actually at present 10 years old.
Mm-hmm.
He had this mouth sensory problem even. So recently he had just left the chew tube, and now his speech has become just too less. Before that, he started with few words during the time of lockdown, before lockdown, sorry,
Okay.
and now his speech has almost gone. But sometimes when he speaks few words, the clarity is missing.
Okay. So,
So in that
are
case,
you
what
going
can
to any
we?
speech therapy currently? Are you doing any speech therapy currently?
No.
No. Okay. And you said that he can move his tongue, right?
Yes.
He can
Yes.
move his tongue laterally, or he can elevate it also.
He can move his tongue.
He can move his tongue laterally or elevate also. He can do both the
Both,
things.
both the ways. Both the ways.
So you said you have stopped the chew tube. And which chew tube was it?
T.
No, T. What? Which color?
Red. Red color.
Red. Okay. So he was on the first chew tube in the hierarchy, and you said that jaw strength is not there. Your OT is telling you. But when we are working, when we don't have a jaw strength, we have to work on chewing. That
Hmm.
only he will get the jaw strength. Okay, but we have to see if the child is not taking the chew tube properly. weak. If the jaw is sliding, if it is weak, then what counts we have to work on it. We have to give the count. We have to do the repetitions, right? So how many counts he is doing the tube? Is he chewing it, again and
He
again?
used to chew it again and again,
Yeah,
and he had broken few of the chew tubes even.
yeah.
I had also given him O and P, orange color,
Okay. So
and he had
orange color
broken all
and
those
O and P are very, hard chew
very,
tubes.
very hard.
Very
And he
hard.
had broken those also.
Yeah. So when he is breaking it, that means that he has, he is anxious or he got some stress. Then only child breaks the chew tube. Okay. And generally, child enjoys the chew tube when, because when you are stressed, and if you do the chewing gum or you are chewing, then your stress is releasing. Okay. So whenever the child is anxious or he has some fear, then he will do the chewing. It's not chewing; it's actually biting it hard, and he is breaking it. But if
Yes.
he enjoys chewing, he won't be breaking it, right? But P and Q are very hard to do after the red. There are two chew tubes in between the hierarchy. We have a hierarchy for tubes. Okay, there's one red, yellow, then there's green, then grabbers. Then we go to the P and Q, right? So if he has jaw weakness, we are not supposed to give them P and Q because it will create more weakness. I
Okay.
give an example, like you have joined a gym, okay, and
So
the
maybe, ma'am, it could be that he does not have this jaw weakness, and I'm told this because
so
he can also chew bhutta. He
okay,
can also chew corn,
he can chew corn, okay.
and also guava.
So corn is like, if you're chewing the corn, sometimes corn is very soft and sometimes corn is very hard, right? So which corn he is chewing? Actually, you have to see. And what all teeth he is using for chewing? Is he using the molar or he is using the premolars or canines to chew it? You have to check it. And even while even doing the chewing tube, we have to
He
check
usually use his back teeth
last.
because most of the time, what he does, I suppose, molars.
Mhm.
Because most of the time, when he does not like the taste of the food or something, he keep it here, and he chew from his left hand side, right.
Okay. So
And he used
maybe
to
he
keep it
is pocketing
there.
the food,
Yes,
right?
he's pocketing the food when he
Pocketing
does
the
not
food
like it or
when
when
he
his stomach is full.
right. So he's pocketing the food. He may be like that. One side is very one side is strong than the other side. That's why it's generally at the left side. So his right side may be weak. That's why he's not using the right side, right? So we have to see the asymmetry if there is any asymmetry, and we have to work like that because we have to use both sides while we are eating the food, right? So you have to get it checked with your therapist, whoever is working with him, and
And where do we get OPT therapy, which you are talking about in
see, you
that?
have to search. I am giving OPT online also for my parents, like they are outstation. I'm at Noida and they are outstation like Bangalore and Chennai all. So I am giving them online therapy also, but I can only see and tell you, right? But I can check it online. Is there any weakness in the jaw, right? And what all we have to work on.
Okay,
Okay, so
thank you.
now we have number of questions, and I'm seeing number of parents has raised their hand. So we'll go one by one. Ispurti,
Yes. Hi,
yeah,
good afternoon, ma'am.
Good afternoon.
My son is 4.5 years old, and it's
Okay.
been almost a year. We've been doing OT and speech therapy both.
Mm-hmm.
So he talks fairly, understands questions also.
Mm-hmm.
His speech is more of need based.
Okay.
Apart from that, I have lately been facing an issue that he is biting his nails,
Mm-hmm.
like his fingernails, at times skin also,
Mm-hmm.
and now he started biting his toenails as well.
Okay.
So and I guess he likes hairy textures, like hairy, for example, we have वो चद्दर आते हैं जिसमें एंड्स में ऐसे हैरी
Correct.
एंड्स होते हैं जिनके,
Fibers, so some last bit. Right. I can
राइट.
can imagine. Yeah, I know.
So yeah, but he doesn't do it all the time. Like in case of hairy texture, it's not all the time. Also,
Mhm.
I have observed that he is biting his nails only when he is either given free time, or he's in stress,
Mhm.
or maybe he's anxious.
So
So
you
like
actually you gave the answer yourself. Actually, I was coming to that point only, that whenever the child is anxious or has any fear, right, then only they do the biting. Even it happens with us, right? If we are anxious, we generally do this. Okay, we shake our legs, we do the hand movements or anything. Like sometimes we grind our teeth also when we are anxious. So child
right, right,
is doing it because he is getting anxious. When he is doing it at their free time, that's all. That's because he is calming himself. He don't have anything to do work on, so he is doing it. It's not that you have given him some work, then only he is going to get the anxious, right?
okay,
Maybe when he is sitting not doing anything, then also he can get anxious, because thoughts are always in the mind, right?
right,
So when we are sitting quietly, then our mind is working, so their mind is also working at that time when they are sitting quietly. It's not like they
correct.
are blank, right? So maybe
Hmm.
something is going on their mind, they are overwhelmed with some activities, they are overwhelmed with the environment feedback, right? The
Okay,
sensory input. So he is biting his nails, okay, to calm himself down. So what you can do is, when he is biting his nails or something, you can give him chew tubes to chew, because it releases the stress. Okay, chewing always releases the stress. Or you can
okay,
give him some, if his jaw sensitive, you can give him some carrot to chew. So chewing
okay.
always helps to release the stress, right?
Uh,
And
okay,
second thing, I'm coming. You have said that he likes hairy thing. That means he needs some input in his mouth. He need that feedback in his mouth, because he is seeking that thing. He is seeking
right.
that picture, right?
Okay,
And that
okay.
he is getting from he is putting in the mouth. Okay. So we sometimes we uses that we use I'll show you.
Okay, one question I have with
I'm
everyone.
completing it, just a second.
No, no, one second.
You
Sorry.
take this thing
Uh,
and we
actually,
put the sensory input with it.
yeah.
Or you can use the vibrations.
Vibrations we are already doing, like while massaging him, we are giving him oral vibrations as well.
Right. So you
Like
can
this is
use
happening on a daily basis.
the different texture in the food to increase the
Okay.
awareness in the mouth, and giving the sensory input.
So ma'am, he eats everything, like whatever we eat he eats that, and
Right.
he chews as well. What textures, what, like I just wanted to know what additional do I need to give
I
him.
I just told in the presentation that sometimes what you are getting the feedback from the food, he may be getting half of it, right? You have
Okay,
to increase. You have to give him textured food. Like you can give him Monaco biscuit,
I request, please be on mute.
right? You can give him Monaco biscuits, or give him something like we give rice crackers, right? You can give him that to increase
okay,
the feedback, right?
okay,
Or
okay,
increase the taste in the food.
okay, sure, sure, yeah, thank you ma'am.
All right. Now, Punita Sharma.
Good afternoon, ma'am.
Good afternoon.
So actually, I'm a mother of a special child who has apraxia, and she's like around 8.5 years old now.
Mhm.
So her current issues are like she's currently kissing with deep pressure,
Mhm.
very deep pressure. That is the main observation, and occasional spitting, and the general apraxia issues are there. Like she isn't trained to take out sounds like properly, so everything has to be taught to her.
Mhm.
And lastly, I would like to ask you how to like since we stay in Mayur Vihar now, how can I contact you or any accessible OPT therapist for a home plan? First, I would like to visit, and then I can continue with the home plans.
Okay, so I will, Mr. Pramod can send you my number. Okay,
Okay.
you can reach me on that number. I can provide. You can come to me once for the
Right.
assessment to
Assessment. Yeah.
go for the home plan.
Right.
Right? And regarding the apraxia, you must be knowing what is apraxia actually,
Right.
right?
Motor planning.
Motor planning. So she don't know how to produce sound. She don't
Right.
know how to use the muscles to produce the sound. That's why it's there,
Mm-hmm.
right? And one more thing you ask, please ask me
Yeah,
again.
she's currently kissing picture
Yeah,
books with deep pressure, like some very
depression.
deep pressure. All the picture books, she's very visual learner.
She needs that feedback in her mouth. You know,
Right.
you're getting with the
Yeah.
right.
Especially picture books which she's fond of. She's putting deep pressure on that.
Yeah. So sometimes, sometimes we also teach that you love me, please give me a kiss.
Okay.
You love that, please give it a kiss. Please give me a kiss. When we are parents, we always ask it, do you love me? Give me a kiss. Or I love
Okay.
you, I'm giving you a kiss. So she knows that whatever I love, I like, I have to kiss.
Okay.
Thus, she is seeking the pressure also. That's why she is doing it.
So can we do anything about that to
Yes, when we work on the tool, we give that feedback, okay, and
okay.
they control it,
Okay.
right? They can get a control of it.
Okay.
Yeah.
Sure, ma'am.
Okay. Uh, so can we move to next question?
Yes, please.
Okay, Gargi. Gargi, you can share your question? You're on mute. You need to unmute yourself.
Yeah, sorry. Hi, ma'am. So
Mm,
my child is 2.3 years old. So the thing is, he's not able to chew.
mm,
It's like he wants the food. I mean, if we give him, say, solid things like, say, what do you say, Maggie kind of thing, or omelette or chapati, he'll take very extremely small bite, and so
mhm,
that he can just swallow it. Okay, he just don't know how to chew, and because of that, we are giving him mashed food. Even we are non-vegetarian, we give him fish, chicken. Also, we have to mash everything in the pressure cooker and give him.
mhm.
So he just don't know how to chew. He'll look at our plates and he'll look at us like very interestingly how these guys chew. We taught him, we model it. Still, he's not able to chew. I know
So
he has less molars.
are you taking any therapy for that, like any feeding therapy or any oromotor therapy or speech therapy?
I started 2 months ago. It's kind of play therapy only. They are saying that it will take time for because he's not even allowing anything near his mouth, any
Right.
brush or something. I still did some pressure massages at home, and I have a vibrating brush and I don't know chew tube or what that molar teethers. So the molar teethers also, if I give him, what he does, he'll just chew with his front teeth like this, like this. He doesn't want to put it inside his,
Correct.
molars.
Correct.
And the thing is he wants harder things like
Mhm.
some plastic toys and all. I don't know what inputs he gets. Okay.
So
And
he
other
was
thing,
putting harder thing inside on the molars or what?
no,
There
he
won't be
he don't even
harder
take it
molars.
take anything inside his molars.
Okay, in the on
He just
the
using this thing,
okay.
this part. He has
Okay.
some 3/4 teeth, I mean 2/4 teeth, I saw it's coming up, but he's not using it.
Okay.
So it's very difficult for me,
Okay. So see, sometimes what happens is sometimes child get a you're doing something, okay, and the child get the fear. Okay, if I'm going to put something here, it
Mm,
may hurt, right? Or
mm,
that sometimes what happens is there is no strength, very low strength. That's why child is not able to chew the food. So we have to develop the strength gradually. Okay, you said there are teethers, but the child is not putting it here, right,
mm,
on the
mm.
premolars, right? So we have to develop that thing. If she it's a girl child,
Boy.
boy. So if he bites, can you feel that pain in the finger?
Yes, I can. He bites my fingers or caregiver's fingers. He'll bite it very hard, and he'll
Very hard.
see if we laugh. I mean, if sorry, if we make a
Right.
sound, and he'll make it funny. He'll find it funny. He'll laugh, and then he'll leave it.
Okay, so he won't be understanding right now that it's paining because it's a pain for you. It's
Yeah.
paining. He won't be understanding. That's why he is laughing. right? So we have to actually start, giving him something. First we have to enter his mouth, we have to give some input from outside. Then when once he developed the trust that yes, they are not going to harm me by entering
Mm-hmm.
my mouth, then we have to enter the mouth and we have to work inside the mouth. We have to work on the cheeks first, in the outside area, then inside, then we will go to the teeth. Okay, first they need to uh, there should be an stimulation. Yes, we are going to work on your mouth, it should be prepared to take the input, then
Mm.
only you can work on the teeth. Okay, if they're like, if he is like that, no, I'm not going to allow you to enter my mouth, how you're going to work on the teeth or the tongue, right?
Mm.
First you have to enter the mouth, you have to create that sensory awareness, and then you can work on the jaw. And jaw also, we have to work in a hierarchy, like soft, then medium, then hard. So I am seeing a child, he has cerebral palsy. He was on a mashed food, total blended food, he was on a bottle feed actually. And now after 6 months, now he can chew a parantha. Okay, I started with a soft parantha, aloo parantha, now he can chew that thing, right? So there was like muscle weakness was there, now I've created the awareness, then their muscle strength, now he can chew it, do the chewing. So we have to do the step by step. It's not like I can start suddenly we can start doing everything, right? We have to work step by step. So if you are seeing any therapist, you can ask them to work on his feeding. Actually, the like I said earlier, also whatever muscles we are using in the feedings, okay, and those are the muscles responsible for the speech also, right?
Okay.
So we have to first work on the feeding, then we are going to target other things. And here feeding is affected.
Mm.
2.5 years old child should take the solid food,
True.
right?
True. Yeah,
Right.
I agree.
So we have to work on the feeding skills first, then we can target other things.
I have one more question, ma'am.
Yes.
He is very much fond of, like, as you say, salty, crispy things like potato chips, some
Mm-hmm.
pakora, fried fried things. Those
Mm-hmm.
things he'll take one, I mean, with his hands, small, small bites, and he'll just taste it and
Mm-hmm.
he'll swallow it. So is it
So
hyposensitive?
yes, it is. It may be hypersensitive. You can ask the OT what is his body tone, because 99% whatever is happening in the body, it happens in the mouth. If the child has a hyposensitive, in the body, like you can see his structure. If sometimes you feel he is clumsy or
Mm.
he is not doing all the activities very actively,
No,
that
yeah.
means that he may be hypoactive. That's why he is not feeling inside the mouth also whatever you are giving. So he need more, you know,
Mm-hmm.
more crunchy, more salty, more tasty than you.
Okay, so when you say it's not only the mouth which is hyposensitive, the entire system is
My system
hyposensitive.
is hypersensitive.
Okay, but
Okay.
yeah, but yeah, he's not hyper. Definitely, he's not hyper. But
So do he
when
see the textures when when you're playing with him?
what kind
Any
of text? Food
texture?
textures?
Any texture, like he is touching something, he enjoys that when you're playing the messy play or something.
Yeah, yeah. Right now we have started this foam play. Foam play with colors and all. He enjoys a lot, but
Right.
he doesn't interact much with us. That is like, okay. They say that he will interact later, but he, and even the aloe vera and all, he'll put in his hand
Started the
and
play. You have already started the play, so he will start interacting with you when you are doing the play therapy with him, right? But I'm asking that, is he enjoying the messy? You said yes, he is enjoying
yes,
that foam
he's
thing.
enjoying. Yes.
So he is enjoying, that means he is taking the feedback from that thing. So that
Hmm.
means he is taking the
Okay.
feedback in the mouth with the food you are giving him, right? So he
Yeah.
needs more textures in the food also, he need more taste in the food also.
Taste in the sense, what do you mean? Like
Taste in the
masala or
sense,
salt?
yeah, masala, salt.
Mm.
He won't be liking, according to my experience, he won't be liking you are giving him bland food.
Yeah, we normally have bland food actually.
Yeah. So he likes it, the bland food, or
I
he just take
don't.
it.
Um, I think you're right. He needs more of this salty things and all.
Yes.
But
Yes.
salt is also not that good, right? I mean, for
It's not
body.
that good. It's not that good. That's why, as you have see, whenever we start working with the child, we always start working with the temperature first. then we
Mm-hmm.
go to the taste, and then we go to the textures.
Mm-hmm.
But to reach there, to give them proper feedback, we have to give them mixture of it. If the child is not feeling the way you are feeling with that food, they will obviously want more of it. You are getting, I'm giving you half spoon of salt in a something, in a katori of sabji, right? And you are feeling it is okay, but he won't be getting that feedback that you are getting from that sabji. So he will think
Okay.
that this is no lesser for me because he's not feeling it in the mouth. It's not the it's system. It's not that he wants to get the more thing of it. It's a
Mm-hmm.
system that is not giving him that response. So once we start working on the sensory system, he will start getting the feedback.
So when you say like external sensory stimulation, those kind of things, right? Messy
Yes.
play
Messy
and
play, you can ask him to do the gardening. He can play with the
yeah,
sand.
he always touch all leaves and
Yes,
he
yes, because
all
he
those
needs
things.
that feedback from the environment. That's why he is doing it.
So just one more question. This will stay in his body for lifetime or this gets
When we
integrated?
work
Like,
on it, it gets integrated.
and how much time does it take
That I
normally?
cannot tell you.
Okay, just to let you know, uh, he is. I think his muscles are not weak because he's able to tell all the speech of alphabets, everything he is able to say. So I believe his muscles are not weak.
Mhm.
Somehow he has
The
this
sensory
sense.
system is responsible for it.
Okay,
Okay, and when our sensory system is affected, somewhere it is our motor planning is also connected with it. Okay,
okay,
that's why it's like sensory motor system.
okay. And does OPT will help him in this
Yes,
case?
OPT will help with
Okay, okay. Thanks, ma'am. Thanks.
most of it. Yeah.
Okay, now we have Neha.
Yes, good afternoon, ma'am.
Yeah.
First of all, thank you for sharing so much of information with all of us. Thank you. Ma'am, I have two questions.
Yes.
My child, he is 6 years old. So,
Mm-hmm.
number one question, he has speech, but the clarity is still not there.
Mm-hmm.
So, if you can recommend few exercises that can be done. And my second question is, when he keeps on making noises like kissing noise, he will make mwah, mwah, and then he also does cull this kind of noise he's very fond of. So
Mm-hmm.
whenever he's bored or anxious, he will start making this voice. So I'm not able to understand, is he looking for a sensory input or what? So how can we help him in this?
Okay. So first question for some exercises. Okay. So I cannot suggest any exercise until and unless I see the child. Okay. It's always a tailor made program, right? And every exercise is not for every child. So first I have to see, or any therapist you are contacting, they can tell you the exercises. Second thing is that you said that he always makes some sounds. That is related to, sometimes child needs a auditory input. Okay. Okay, so to calm himself, he needs an auditory input always. So you can start giving him, in the background, you can start the music, give him some music and see that is he still making that sound, or he is just, stopped and doing the work calmly. Because when we are the input, it is because we have that sensory thing, and that auditory input is actually calming me, you know uh, okay, I give you an example. Sometimes what happens is that we are doing some work, okay, and we do the humming when we are, enjoying it, and we want to calm ourselves, and if we want to focus, we do the humming any song, correct? We are singing some song. So why, how is it helping in making the, if I'm making the food in the kitchen? So it's actually creating a, it's creating a calming effect, and I am focused in the work I'm doing, correct? So I need that auditory input now. Otherwise, why, how the food and singing is connected? Because I'm enjoying that sound, and I'm enjoying the making the food, correct? So that sound he is making, it is calming for him, it is giving him an auditory input. You should check with his OT that is he seeking any auditory input, is he uh, has sensory issues with the auditory. You can check with him. And one thing at home you can check, you can start music in the background, and check that is he still doing the same, right?
Okay, ma'am. Okay, thank you so much, ma'am.
Most welcome.
Okay, next is Ramu Mandana.
Hi, good afternoon.
Good
Actually,
afternoon.
I'm a father of a 6-year-old child. Actually, she put a lot of things in the mouth, like small objects,
Mm-hmm.
like metal items, so sometimes soap, the balloons. She put a lot of things in the mouth, and she been having the therapies for almost 2 years. Uh, there is some, she can talk, she can sing, but there is no functional communication. That the functional communication is missing.
Okay.
She can sing, she can say the word, or she can say the sentence, whatever we say she repeats maybe for 1 minute or 2 minutes, but
Mm-hmm.
the functional thing is missing.
Okay.
Yeah, and could I know what is the root cause? Actually, there is some solution for correcting, I understand that, but what is the thing missing? Every ASD child is different, behave different. So what kind of hormone, or what kind of, I don't know, what could I say that, maybe the hormone, what hormone is missing, and what hormone is the, making that thing.
Okay. So coming to the hormone thing, you should actually consult your pediatrician or your developmental pediatrician. They will be able to tell you what is
Hmm.
responsible for the behavior. Actually, every child is different. Each and every child is different, and they have different behaviors and everything. Okay. And first thing you said, she is putting non-edible things in the mouth,
Yes,
right?
yes. Hmm.
Right. But is she taking the food also or not taking the food? Is she is interested in the food or not?
Yeah, she is a picky eater, definitely she's a picky eater.
She's a
She
picky
put
eater,
the
but
food.
she's
Yeah,
taking the food, right?
yeah, taking the.
Picky eaters are like they will not like to try each and every food in the table on the table, right?
Yes.
They like to eat food what they like, correct?
Yes.
So
Yes.
why it happens? Because sometimes what happens is the child likes some food, okay, and we always give them that food that they like because we want them to eat,
Mhm.
okay, and that food is giving them a proper feedback whatever their mouth need. So they and sometimes the mouth has a hypersensitivity. They don't want to take the taste that you want to give them, okay. So
Mhm.
their mouth is not actually ready, or they are not give it's not brain is not giving them the command to take inside, right? So they are avoiding some food that you want to give them, okay. And another thing is that they want some feedback, and they want to feel something inside the mouth. That's why they whatever is coming in their way, they are keeping it in their mouth, okay. Non-edible things also, but she won't be swallowing the things, right? Or is she swallowing it
Sometimes
sometimes, right?
she keeps the thing a long time in the mouth. If we don't
In
see
the
that.
mouth, because
Yeah.
what happens that our oral structure is like that. My tongue always tastes, right? It gives me feedback what it is in the mouth, okay. Jaw feels the strength of the object, correct.
Mhm.
And lips is not playing any part in the feeling that thing, okay. So my tongue is not having that sensory awareness. That's why I'm always taking something in the mouth, and why I want it to be filled with anything, okay. I just want the feedback from the things. That way I'm taking something and keeping it in the mouth, taking something and keeping it in the mouth. But when we work with the tools that we use in the oral placement therapy, we work with the tools, it creates awareness, okay, and it gives you the feedback the child needs,
Mhm.
right? So when it creates awareness and child get that feedback, they stop putting the things in their mouth.
Yep.
Coming to the picky eaters, I would suggest, even if the child is a picky eater, I would suggest always keep take the food together. Family should have the dinner or lunch together. Try to be like few people are with him or her, or and also giving small portion of the things that she don't want to try, okay.
Okay.
Keep it in the plate, and if she wants to, then she can try. First thing is that the child look at the food or smell the food, then it takes in. So we can try, don't do this that I have uh, mixing something in the something that she likes and mixing the things she don't like, and I'm just putting it in between, and she will take it, and I'm trying it. So that creates a fear that they won't give me something like that. Okay, do never do that. Put everything in the plate that you are eating and let her try. Okay, never think that she is not eating it, so I'm not going it give it to her tomorrow. Always give small portion of everything you are eating. She will look at it, and one day will come that she will start taking the things.
Okay.
Okay.
And the functional communication part, actually,
Yeah,
she.
functional communication is, you have to work on the communication. You can start with the role play and pretend play with her. And see, when the child is communicating, when there is a need. Okay,
Yeah.
but you never told me that she is a need based. She can communicate. You said she can sing the rhyme, right?
Yeah. Yes. Yeah.
Okay. So that means speech is there, but to and fro communication is not there. Then you have to create a scenario that she has to speak. You can start with the bedtime stories with her. You can narrate stories to her. You can read with her if she can read.
Yeah.
You can start pretend play. You can start role plays. You can start taking her to the market and show how to buy things with her, right? With the
Mhm.
people, from the people. And you can ask her to talk to somebody on the video calls or the phones. So you can show her how to, when I'm saying that how are you, she has to say I'm fine. But you need not say I am fine. Okay, you
Mhm.
have to coach her. Not coach her, not saying her, but you have to let her see that how we talk. Because for communication, functional communication, we have to give the chance to child to speak. And generally what happens, I'm asking the child what is your name, and if he or she is not replying within 5 to 6 seconds, we generally, we say her name is this, right? But you should at least wait for 30 seconds, give a chance to the child to speak up, right?
Mhm.
Every time you have to wait and give her the chance to speak and create situations so that she can come to you and ask for something. First she will start need based communication, then we can go for the to and fro communication, right?
Okay.
Yeah.
Yeah.
Uh,
Thank you.
yeah. So next, right now it's 1 o'clock. So we will take a couple of more questions, and then we can close.
It's going to be two.
Oh, sorry, 2 o'clock. Yeah.
Yeah.
Shruti, over to you. You have question?
Yeah, hello, ma'am. My daughter is 7 years old. So she has chewing issues, picky eater, and a need-based communicator.
Mhm.
But from past 3 months, she is biting her lower lip. It's all the time, like for hours and hours, like that. If I don't interfere, she keeps on chewing, biting her lower lip, and
Mhm.
it interferes with eating and it interferes with speech. So how do I stop that?
Can you repeat? It's your voice was breaking actually in between. I was not able to hear properly.
Yes, ma'am. She's biting her lower lip all the time.
Right. Okay. She's biting her lower lip. You can see that. Is there anything, because generally when we do the biting the lower lip,
Mm-hmm.
anxiety can be the reason, right?
Mm-hmm.
Because biting the lips can never give you any feedback. Correct? If
Okay.
you want to bite, you can bite on the food, you can bite on the YouTube, right? So you have to check, is she anxious when she's biting the lip? Does she has any
Uh,
fear when she's biting the lip?
Sometimes she's anxious, but most of the time she's not, ma'am.
Okay, and you have to see that is she sensory overloaded? Is the environment overwhelming her, right? You have to see every aspect when she is doing the lip, biting the lip. You have to check when she is doing the biting lips, right? And then you have to work on it, because it's not giving her any feedback when she's doing it, right?
Oh,
So it
okay.
it is due to maybe her, like, anxiety, maybe
Mm-hmm.
the environment, maybe anything, like she wants to say something, she's not able to say something, right? Expression, it is
Okay.
related to that only. It's not like you can do anything with the biting of the lips. It's only that thing.
Ma'am, as you said, she might be oversensitive or
Overwhelmed or
oversensitive.
yeah, overloaded with the sensory things.
Yes, she likes to play messy play all the time with water, soap, foam. So she like that kind of play very much,
Mm-hmm.
and make some oral sounds all the time.
Mm-hmm.
Weird
Okay.
sounds. She makes some weird sounds.
So I replied to this question that she makes sounds all the time because she may be auditory seeker. Okay, so you can try with the some playing some music in the background and check it that is she getting that calming effect from it or not making the sound after that, right? Because child makes sounds generally when she need the auditory input all the time, and she is already, you told me she is a mess, she loves messy play. That means
Okay.
it is hyposensitive. Okay, she need the feedback all the time, all over the body. Okay, so it's an auditory seeking also. So you can
Okay.
start playing something in the background. Okay,
Okay.
she needs something to calm her body down, right? That's
Okay.
why she is doing everything. So it's good to be messy. When if she loves it, it gives her feedback. You can make her do that thing. You can start making her play with the dough. Okay, when you are making any roti or something and you are making a dough, you can ask her to join you doing that because it gives you a lot of texture when you are making the dough,
Okay,
right?
ma'am. Okay. Okay, ma'am. Thank you
Welcome.
so much.
All right. Minakshi. Minakshi Sundar.
Yeah, my son is 8.5 years old. He always tear the paper and chew. If I ask him to just take it out, then he will automatically not. He's just spill out. But most of the times, no, he tries to chew the papers and plastic papers. So,
Mhm.
what could be the reason? How to avoid this?
Okay, so when you're asking him to give it, he will spill it out, right? Spit it out. Correct? So he is taking textures through the things he is taking in the mouth. Okay. He needs some feedback in the mouth. That's why he is taking it in. So you can give him different things to eat that is textures. Okay. Like I suggested earlier, also you can give the Monaco biscuits, you can give the crackers, and you can give them cucumber. Okay, it gives a texture. You can also give them flavored things like chips or something, and you can give the massages to them with the vibration. Okay, that will also give the feedback. You must be doing some massages inside the mouth for him, right? Or you're not doing anything like that. Minakshi, I'm asking you.
Yeah, yeah. Actually, we used to give chips and biscuit, that Monaco biscuits. But the
Biscuits.
thing is, he always likes to eat most of the snacks items,
Right,
mixture.
because snake items are more, most of the snake items are tasty, right? It gives you a lot of taste rather than your food, normal food. That's why he wants to take the snacks more than the food, right? It's giving him better feedback than the general food. That's why he loves to have that snacks. So you have to do some massages, you have to give the vibration in the mouth to create that awareness in the muscles so that he can feel the food, right? And whenever you're making his food, try to put more, tastes to it, like spices, so he will be happy to take the food.
Okay, okay, madam.
Yeah.
All right. So I don't see any other raise hand as well as any question. I guess we have addressed all those questions. So
Okay.
Anjali, I'm seeing here Anjali has posted one question
Yeah.
related. Is Anjali there? No. Okay. Dia Kazi. All right. So anyway, so if anyone has any further question, they can share their question with us over WhatsApp. I shared those numbers here in chat box. You can refer that, and yeah, so we can close this discussion here. And thank you so much, ma'am. Okay,
Oh,
sorry. I'm seeing here Dia Kaji hand.
yeah. Hi, Dia.
Hi, hello, good afternoon.
Good afternoon.
Yeah, ma'am, my son is 5 years old and he doesn't eat fruits. Only he takes like the form of juices, you know.
Mhm.
How do you think I can get him used to eating fruits in solid form? He doesn't chew in the food that the form has cubes, you know, or slice kind of fried chicken. That thing he doesn't like. So what can I do for that?
Okay, so you want to say that he is not taking the fruits or any food in the solid form.
Yeah,
Any food he's not taking.
no, fruit, I mean.
Fruit only, and other foods he is taking.
Food, yes, but the form of cubes like fried chicken or any fried items, like hard, you know, hard
Mm.
shape, like corn if I give him, or pomegranate seed if I can give him, he's not eating that thing.
He's
He'll
not
not take only. Yeah.
okay. And he can have roti, paratha,
Yeah,
everything
everything he eats.
he eats.
Pappad he likes, yeah, Monaco biscuits he likes.
Okay. So only fruits he is not liking to take the bites, right?
Yes,
So how much big cubes you are giving him?
like small cubes only, ma'am.
Okay. So you can start with the banana first. Okay.
Mm-hmm.
So what you have to do is, like, I have made a banana shake first. Okay, I will give it to him. And he is taking it. You told me that he is taking the juices and
Yeah,
all.
he taking all the juices,
Right. So
smoothies.
give him the banana shake. Okay, and then after some time, give him a small bite of like cube of 1 centimeter by 1 centimeter cube of banana between his molars. Okay, by that with the
Mm-hmm.
help of toothpick, you can give it to him, and then ask him to make a chew on it only once. Right,
Okay.
then he is getting the input, yes, I can take it. Okay, next time you can give a orange juice and give a bite of 1 centimeter by 1 centimeter cube of orange, one side this side, one side, one time this side. Start giving him that thing that he can take it. Okay, he can feel it. Maybe he is taking the juice but he is not liking the fiber he is getting from the fruit. Okay,
Yeah.
whenever you are taking a cube bite of the fruit, it's giving you a fiber also, right?
Mm-hmm.
Whether you take a orange, you take a banana, everything is, you are getting a texture on your tongue. But when
Mm-hmm.
you are giving him a juice, it's not giving him that texture, right? He is taking a liquid inside, right? So you have to create that awareness by giving him a very small cube of the fruit between the molars only, and only two bites of that. Okay, initially.
Okay.
Then if he starts taking it, then you can increase it. Or if you are giving a chew tube to him, then you can put the fruit that in the chew tube and ask him to bite it. So it will go into the mouth directly, right?
Mm-hmm.
And
Okay.
you can try that thing with him.
Okay. Okay, ma'am. Thank you.
Okay, welcome. Shruti has a question.
I guess she has already asked this question. So, yeah, thank you so much, everyone. And thank you so
Thank
much, ma'am,
you.
for
Thank
all
you.
these informations and answering all the questions. So, based on further parents' questions and points, we can plan another webinar on that.
Right, right.
And it was really very, informative session. Thank you so
Thank you
much.
so much.
Yeah, thank you.